In this video, I'll be explaining and demonstrating a couple variations of the radial nerve glide. You should consider giving a radial nerve glide to any patient with any of the following presentations. So number one's kind of obvious, adverse neurodynamics of the radial nerve. Now, adverse neurodynamics is a very general umbrella term, but in general, any patient with a positive radial nerve tension test should probably be given a radial nerve glide. Also, any patient with numbness, paresthesias in the radial nerve distribution of the hand. Also, patients with post-concussion syndrome, so mild TBIs. Oftentimes after the original concussion and injury, they develop adverse neurodynamics in all three of the major upper extremity nerves, radial, median, and ulnar nerves. So this would certainly be included in that. Patients with radial nerve entrapment, so for example, supinator tunnel syndrome. Patients with a cervical radiculopathy, and those with thoracic outlet syndrome. To perform the radial nerve glide, the patient will be positioned in sitting or standing. And if you're the patient, you're going to start by having your arm by your side with your elbow almost completely straightened and palms facing forward. That'll look like this. Doing it with my right arm here. And from here, I'm going to make a light fist. Now to get into position one, I'm going to internally rotate my entire arm such that my arm moves slightly backwards, so just barely behind my body, and the palm of my fist is facing backwards. So that'll look like this. So that internal rotation, now my palm is facing backwards. You can kind of see my arm move slightly behind my body into shoulder extension, and you'll also notice that I get a little bit of wrist flexion there. Okay? And then I'm going to tilt my head toward that arm. This is position one. This is probably the most complicated of all of them to do, so it might take some practice for you as the practitioner also to know how to explain it. So this is position one. Now from here, I'm going to return my arm to the original position where the palm of my fist is facing forward, and I'm also going to tilt my head away from my hand at the same time. This is position two. And just like any of the other nerve glides, we're going to oscillate between positions 1 and position 2. And again, we're going to hold maybe 1 to 2 seconds in each position, move through a slow and controlled range of motion, and perform about 15 repetitions per set. So this is the first form of the radial nerve glide. Now we can progress the radial nerve glide by just adding more shoulder abduction, so my arm is now elevated more out to the side. This shoulder abduction puts additional tension on the radial nerve. Again, elbow is almost completely straight, a little bit bent, and you can see here I've got the light fist, and my palm is facing more or less upwards and maybe a tad forward. And my head is tilted away from my hand. This right here is actually position 2. But again, we're going to do the same movement. I'm going to go through that entire internal rotation, tilt the head toward. And we're just going to oscillate between position 1 and position 2. So there's really no difference between this nerve glide and the previous one, other than the fact that there's more shoulder abduction. Okay? And as always, we need to use the test, treat, retest model. If somebody had a positive radial nerve tension test and you gave them this as a treatment, we want to know that the treatment actually made a difference. So we would retest them with the radial nerve tension test with the hope that it would either be negative or there would be less tension. Thank you. Thank you for all your support. Be sure to check out my Instagram for cool science and not science stuff.